if you don't take care of yourself,
Right.
everything else falls apart. Everybody needs you. And so you have to be selfish.
Put yourself first. Get the
Right.
best information.
So that could become, sort of your Bible of your own health, right?
People enjoy helping. The other thing we then say is, and then let it go.
Welcome to Climbing the Corporate Ladder Without Breaking a Heel. I'm your host and your coach, Dr. Cynthia. With over 30 years in the corporate world as a single mom, cancer survivor, and often the only woman in the C-suite, I understand the balancing act high-achieving women face. Now an executive coach and international speaker, my mission is to embolden every woman in the C-suite or on the rise to claim her agency and challenge the norms holding her back. Tailored for ambitious professional women, this show offers candid conversations with powerful business leaders sharing their real stories of success and failure. If you're ready to look up and step up, you're in the right place. Join us right now as we invest in your future today.
Hey everybody, it is your coach, Dr. Cynthia here. I am so excited to be with all of you today. And as we think about women's health, specifically in the month of October, I could not be more thrilled to introduce our guest for today. Dr. Tiffany Troso is a double certified medical oncologist with over 25 years of experience specializing in breast and gynecological cancers. She's a former attending at Memorial Sloan Kettering. She's treated thousands of women navigating some of the most complex and emotionally charged diagnoses in medicine. She is now the founder of Winning the Cancer Journey and Second Look Oncology. She offers personalized cancer consulting and concierge care. She's also the host of her own podcast, the Empowered Patient Podcast, where she spotlights conversations that transform the doctor-patient dynamic and champions a simple truth, which I love this so much. When it comes to cancer, you must put yourself first. She is nationally recognized as a speaker, an author, and a patient advocate, and her mission is always the same. Listen up, ladies, to empower women to take control of their care and their future. So welcome. We are so delighted to have you, Dr. Troso. So good to have you here.
Thank you. What a wonderful introduction. I'm going to have you at all of my speaking events.
Well,
please.
absolutely.
That was so nice.
Yes, put me on speed dial. As some of our listeners know, I am a 17-year breast cancer survivor. So this conversation is particularly personal to me, having walked that journey, and enough years ago that I pray that things have changed a lot. that some of the challenges that I encountered all those years ago have been repaired, but I know that it's not completely fixed yet. But let's start at the very beginning. I love your concept of put you first.
You.
Talk about your brand of Put You First and just your sort of your passion and your mission behind that.
Sure. It's always hard to figure out where exactly to start. When I was in practice, I'm seeing primarily women. 95% of my patients were women. And women are the caregivers. Traditionally in our society, we are the caregivers, we're the rock, we're the spoke in the middle of the wheel. We, keep it all together. But yet when a woman, particularly when they get a severe diagnosis like cancer, I was astounded day after day, patient after patient, how we still weren't putting ourselves first. It's almost societal, right. And it can be dangerous for the patient as well, as for ourselves, and I can tell you stories about how I didn't put myself first. Ask me when my last mammogram was. So as I tell my patients, do as I say, not as I do, but it's a work in progress. Anyway, my point is that I found that by helping women realize that putting themselves first and enabling others to help them actually really improved their care overall and their quality of life. And so, just a couple of little examples.
Please,
if you're
yeah,
interested.
Absolutely.
I would see I mean, this can happen at every age and walk of life. I would see a grandma who is 73 years old, and her daughter is in the midst of height of her career, and she's a banker, and she has 3 children, and grandma watches the kids on Tuesdays and Fridays and what have you, blah, blah, blah. And the patient herself, the grandmother, would avoid treatment or tests or anything that might potentially interfere with that. And so one day there was a problem and we had to delay her chemotherapy, for example. And I said, well, why don't we do it on Friday? I think your blood counts will be up by then. And her daughter was with her. And she looked at me and she goes, oh, I can't do that. I watch the kids on Friday. And I looked at her daughter and her daughter said, but Mom, I have other options. I could certainly get, Aunt Lucy can watch them for me. There's no problem. And then the mother was like, oh, okay. And, but if you can see that, the patient was immediately not worrying about herself. She was worrying about inconveniencing somebody else, for example.
Right.
I've seen, Wall Street bankers or Wall Street women in industry, and they have got a big report due next week. And so they don't want to start chemotherapy for 2 more weeks because they don't want to, their boss really needs this report from them and they don't want to put anybody out at work or what have you. So those are just small examples, but the big examples come from when patients are not thinking it all the way through in terms of their symptoms and their side effects and what's really going on in their treatment. So imagine you had, again, let's go back to the grandmother that I was talking about. It wasn't this particular patient, but I had a patient who had a son and a daughter. Daughter lived out of state, son lived close by. And the patient had a type of chemotherapy that gave her quite a bit of diarrhea. And are you allowed to say that on the show?
Yeah, absolutely.
So she ended up not feeling well and having this terrible loose stools for a couple of days. And she wasn't keeping up with her fluids and she wasn't really eating well because she didn't feel like going out to the store and nobody was bringing anything to her at that particular point in time. And she collapsed and she broke her hip.
Oh my gosh.
And she goes to the hospital and now she has, dehydration, some kidney insufficiency, a broken hip that needs to be repaired, and she has cancer and she needs to get chemotherapy, et cetera, et cetera.
Right.
So, I have actually at points in time written on my prescription pad and handed to my patients, put you first and put this up on your mirror in the bathroom, put it up on your refrigerator so you don't forget, because if you don't take care of yourself,
right,
everything else falls apart. Everybody needs you. And so you have to be selfish, but it's not selfish. It's actually smart if you really think about it. So that was a long soliloquy about, put you first, but I think you get the idea.
It's so important because it manifests into so many other things that are much worse. It's the notion of put your mask on first, right? You're better equipped to handle all the things, wear the cape, do all the things when you are taking care of yourself. And what occurs to me is the couple of examples you used, which were so helpful. I imagine that with younger women that have young children, right? We don't, fortunately, well, and maybe correct me if I'm wrong. I was going to say, fortunately, we don't hear as much of the pervasive cancers in some of the younger women, but terrible when those occur in your 30s or, I was in I had just turned 40. I was not expecting, right, that to happen. I was still raising children. I would think that we're even less prone to follow up on our mammogram appointments and do the self-care that's required. Has that been your experience as well?
Yeah, I mean, especially somebody as young as 40 or even 35, they may not have wasn't even on their radar, for example, to get a mammogram. And so unless they had a family history or something that would, clue them in that they need to be getting this done, it's not even necessarily, a standard of care at this point. So for sure, women definitely don't, think about their health. How many times have you seen a woman go to work ill? Right? She's got a cold, but she doesn't want to inconvenience anybody. She doesn't want anyone to have to cover for her.
Right.
So she goes to work even though her, head feels like it's going to fall off. But off we go because that's how we're trained. That's what, we're ingrained as high functioning individuals, and it's hard to break that habit sometimes. But but it can happen. It can happen. And I think that, some of my program and my book that's coming out goes into a lot of that, into, how to let others help you, how to prioritize what's really important in life and kind of let the other things go and let those things be delegated, perhaps, right? And, it's an example for when you're sick or when you have cancer and on treatment, but you know what? It's pretty much applicable to a lot of things in life for us, right? We don't have to do everything.
Absolutely. Well, two things came to my mind as you were talking. One is I was reminded of being maybe 48 hours post-op from a lumpectomy. And we had this massive meeting that just the leaders were involved at the time. And I went. And I wasn't feeling great. I was still, there was still a lot going on. And of course, I was dealing with a diagnosis and all of those kinds of things. And as you know, so many more questions than answers in those early days, right? But I went, and looking back on it now, I'm thinking, I'm not sure that was a pivotal meeting in my career. I'm not sure that made or broke anything that happened. Right. But at that time, it felt like, oh my gosh, I have to be there, rather than what probably would have made a lot more sense is taking care of me. But I felt like I had something to prove and something to be there. You talk about we don't ask for help, and I think that's so important. And we did a lot of researching women around the world, and that is statistically true, that we just tend to not ask for help for a variety of reasons. And talk about, from your book, some of the practical ways and the advice that you give about taking time, asking for help, and being okay with that.
Sure. I think one thing that might be helpful to your listeners, because I think this is helpful not just for a cancer patient, but for women in general, is I have my patients, when they're doing the whole program with me, write down the 5 most important things in their life. The 5 things that are you can't trade up, only you can do those things. Write those down. What are the most important things in your life? Your relationship with your husband, your, seeing your grandchildren, being healthy, whatever it is, write your 5 most important things down. And then on the other side of the paper, I want you to write down everything that comes to mind that you need to do in the next 2 weeks. Everything, right? Which comes from, I have to do the laundry, I have to pick up the dog from the groomer, I have to go to the supermarket, I have a report due at work, I have to see 25 patients tomorrow and be out by 5:30 so I can pick up my daughter from ballet, and blah, 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 right? And so once you make those 2 lists, it becomes very clear that all the things that you have to do, most of them are not the most important things to you, right? And so what I then have my patients do is then on that list, let's put a little check mark next to something that could potentially be delegated to someone else, right? Now, the next step of that is very important, very, very important. It's critical, actually. On another piece of paper, I need you to write down 5 to 10 people that you can count on that will jump to help you.
Right.
That you won't feel bad about asking them to help you, but even if you feel a little bad, they will help you anyway.
Right.
And you write those people down, okay? And then this is it's fun and it's complicated because not every person is well equipped to do everything that you need them to do. So my sister Lori, I don't have a sister, but my sister Lori happens to be kind of a hothead and very reactive and very funny, and I love her company, but she probably isn't the right person to bring with me to my appointment with the doctor to ask questions and take notes, right? I need somebody who's very organized, who takes notes, who can, synthesize the information and help me ask the questions that I need to ask, right? So my sister Lori wouldn't get that job, but Lori would be wonderful, perhaps, to, I don't know, take me to get my nails done a few days after my treatment when I don't feel well and I just need to be cheered up, or you understand what I'm saying. And so what's really important then is that you take these 10 most important people in your life that can contribute to you, and you really actually honestly think about who they are to you, and how they would react in certain circumstances. Because, the patient's friend who gets very nervous or gets very anxious at the sight of blood and doesn't really like to be in a hospital, she's not the right girl, even though she offers, she's not the right girl to sit with you in the chemotherapy suite, right? And so you have to, and then what you do is you match all of those jobs with the personality types and the people that can help you.
Yes.
And, you know, it's this kind of like systematic way of being the boss of your life.
That's right.
That actually really helps women empower themselves during a time when their power is being taken away, right?
Feels so much more
that's a little
control.
example of what I do.
I
Yeah.
love that so much. I want to say that back because to your earlier point, for the woman listening who isn't going through any kind of cancer diagnosis, which, you know, we hope the vast majority of listeners are not, right?
Sure. Sure.
But what you just described applies to every woman. I'm just going to put it there, period. Every woman, because we're all busy. And we actually talk about this in Now Near Next as well. And I love this notion to say back to you of, you know, what are the 5 things that are most important, your priorities that you have to do that nobody can replace
Your non-negotiables.
Yeah. And then what are all the things that you have to do, you think you have to do over the next couple of weeks, which obviously don't always line up, and generally speaking. And then the 10-ish people that you could call upon that be willing, even if maybe not the first person to raise their hand, but they'd be willing. And then match that to the right person for the right job, which I love. We actually talk about that in our book as well, just in general. For the woman listening that says, I need help, that's a great start. The one thing I would add, I'd love your reaction to this, is that the other thing we then say is, and then let it go. Because if Sister Lori doesn't load the dishwasher the way you like it loaded, and you come back in and redo all the plates and glasses because it's not like you wanted it, or you refold all the clothes, or, you know, pick the task, you've sort of defeated the purpose, right? So you do
100%.
also have to say, I'm delegating this, and it might be different than I would have done it, and that's okay. As long as the thing gets done, let's just let it go and delegate it. Yeah.
And it's sufficient. It works. It's not my way, but it'll work. You know, it's funny. I in my other walk of life, I used to do party planning. And I belonged to this beach country club. And I used to plan all the nighttime events for the whole season. And I had a team, and a lot of them were my friends. And I really had to learn that, what you were just talking about. Because just because it's not my way or the highway, sometimes it has to be their way too, right? And as long as it's pretty and it was functional and the menu was liked by everybody, and even though if it wasn't the dish I would have picked, let it go, right?
Yeah.
And so,
I'm
you know,
still learning
and
that.
that's the hard part about delegating. Yeah, no, that's true. It's true.
Yeah, I'm still
The other,
learning
you know,
that.
the other little caveat that I didn't mention is that women should also, particularly when they're in a crisis situation or cancer diagnosis or what have you, try and find a lead in that for you, so that, you know, when people are calling like, oh, how can I help you? Call my sister Lori. She's got the list, and Lori will match you up with something. That way you don't end up with 4 lasagnas on Wednesday night and, you know, 2 Afghans that you don't necessarily need. But, you know, hey, it would be really great if somebody could pick up the dog from the groomer, or if somebody could, you know, take a look at my mail and make sure there aren't any bills that need to be paid and bring those to my attention. You know, there's all levels of things that people can help you with, but it is also helpful to kind of have a point guard or, you know, the person that'll help you to organize all that so that you don't have to be doing that as well. So
I love that. And, you know, what also comes to my mind is the helping person. One of the things that I really had to learn through my breast cancer journey was, people enjoy helping. It's such an out of control feeling, right? It's such an out of control feeling when your friend or your sister or your loved one is going through something and you can't fix it. And what I had to learn was, you know, Cynthia, when somebody wants to cook or they want to assist with getting the kids to and from school or whatever it is, it's a gift to them to allow them to do that, because it makes them feel as though they're able to at least do something. They can't make you better, but they can do something. And that was really, really powerful. It occurs to me that your advice is for every woman listening and for every man listening that has a loved one that is going through some kind of cancer journey. Identify where you think you can be most helpful, right? So we could also volunteer that. Like, I'm really good at X, Y, and Z. If you need help with any of these three things, rather than saying, hey, I'm here if you need me. Because that's almost overwhelming. As the person going through it, it's like, I'm here for anything.
It's almost useless.
Right?
Yeah.
So I mean, the other part of the advice that hopefully is really applicable to the masses is when somebody in your life, your circle is going through that, be specific about where you can help and show up that you know you can do well and are happy to do it.
Yep.
Yeah. I love it.
Yeah.
One of the things that you do, it's a slightly moving in a slightly different direction, is that you've created this second look oncology. And I'm really interested in hearing more about sort of the value of that second opinion, where that comes in, just in general. I think that that's such an important factor that can be really informational and really helpful in a really scary situation. So can you talk a little bit about that second opinion?
Oh, absolutely. So you've kind of touched on the fact that I have two companies.
Yeah.
Winning the Cancer Journey is really my educational basis. It's my book will be published under that company. My educational processes are all offered through there. My social media work comes through Winning the Cancer Journey. And then Second Look Oncology, I am a physician first and foremost, and that is my medical platform. And so, I'm board certified in medical oncology and in internal medicine, obviously, but, I do subspecialize in breast and gynecological cancer. What I have found is that depending on what the patient needs, I can help anybody. I have patients that have head and neck cancer. I have patients that have pancreatic cancer. When it comes to general review and recommendations, I act as a concierge. In other words, I will dive into your chart with you, review all the records, explain everything to you to make sure that you understand why you got a CAT scan instead of a PET scan, understand why you need an MRI of the pelvis instead of a CAT scan, what have you. And, and then explain in great detail, which most physicians don't have time to do in the clinic, exactly what that pathology report means. Exactly what does FDG avid mean on the PET scan, right? And those types of things. And so I can serve and assist any patient with cancer because I'm board certified in oncology, obviously. When it comes down to giving an actual medical second opinion in terms of, I think you should get this chemo instead of that chemo, I stay in my lane. And that is breast and gynecological cancer, which is what I practiced for 25 years. And so I have been bringing a lot of women in to meet with me. I do it all virtually, which is great. And I have, licenses in a bunch of different states. So what I can do is the same thing. I dive into the chart and I help to review all of the records and help them understand from the ground up exactly what's going on, what their options are, what I agree with or don't agree with. It's very rare that I completely disagree with a physician because for the most part, most of us are pretty well trained, right? Usually what happens is that the doctor hasn't explained things very thoroughly to them. Or, to give the doctors a little credit, sometimes when you're in the office, you're so overwhelmed with emotion and everything else that you're not necessarily absorbing everything.
Sure.
And so having someone like me to be able to sit down quietly on a Friday afternoon or even a Saturday morning and go over everything calmly and quietly with you really changes the whole picture for so many of my patients. And they are incredibly grateful, which I find to be so rewarding because when you see that light turn on, they're like, oh, like, yes, I got it. I helped them. I mean, it's just one of those things. Again, the other thing that I do, and the reason why it's the beauty of where I'm sitting in this virtual medical oncology second opinion world is that I'm not treating anybody directly. So I'm not stealing anybody's patients. I'm not, all the hospital systems like to keep everything internal. They don't want you to refer from one hospital system to the next. I'm like this neutral party, right? And an expert who came from one of the top cancer hospitals in the world. And I can look at it objectively and happy to speak with the physician. It's never, having a second opinion is never about the doctor, so to speak. It's more about the patient. Patient needs to understand more. Maybe somebody else can explain it better. Maybe there are other options that aren't available at hospital A that might be available at hospital B.
Sure.
And so having a neutral party on the outside like that to be able to, also be a buffer between you and your physician, right? Is extremely helpful to patients. So.
Well, there's so much in that, because just from personal experience, there's so many questions. And to your point, there's so much information coming at you. It's a very scary time, probably regardless of the degree of the severity of the diagnosis, right? Because it's still your diagnosis. So it's scary to you. And what I love about this notion of having this person, and what I want to point out is you made it really clear. This is not a competition. This is not I think sometimes fear of working with someone in this way is, well, I don't want my doctor to feel as though I, don't trust what they're saying. Again, put yourself first. Get the best information. What does the woman do that is not in the states where you're licensed? What are the other options as it relates to getting really good factual information, having the kind of support that people can seek out?
Well, it's funny being an MD, because once you have that MD after your name, pretty much everything that I say to a person is considered to be medical advice, even if it's not medical advice. I have helped a lot of patients that are not necessarily in one of the states that I'm licensed in, more on a coaching type of a level, and then try to help them find, more medical care or more medical education in the realm of where they are, to meet them where they are. So I can still review and explain to you your CAT scan. Right. But I probably can't tell you, well, I think you should take aromatase inhibitor instead of tamoxifen here, because that would be really more of a medical prescription.
Yeah.
It's a fine line, and it's something that's moving quickly, because so many physicians are now going virtual. So many people are leaving academic clinical medicine at this point that you're going to see it grow and change in the next couple of years, I'm sure. But for example, my malpractice for virtual actually covers the country. So that at least is national, right?
Got it.
I mean, even this whole notion that each state you have to get medical licensed independently in each state, which costs you thousands of dollars and months of time, it's asinine.
It is.
And why?
It is.
Right?
Yeah.
It should be a national license. It shouldn't be, I'm okay in Texas, but I'm not okay in Idaho. I mean, what? Why?
Right. It flies in the face of everything that is moving in the direction of virtual care. And having spent in the administrative side of healthcare for 12 years, not that long ago, very big into the virtual care space. It was such a barrier, especially with rural healthcare, which is, an entire separate podcast. Yeah. It makes me think too, though, that you are being able to scale some of the work that you're doing with the books that you have coming out and the work that you're doing through Winning the Cancer Journey. So what are some of the resources either available right now or available coming soon that a person could say, gosh, I heard this great podcast with Dr. Tiffany Trousseau, and I need this information now, or I know my loved one would benefit from this.
Sure. Well, I would say, until I get my book published, which, as we discussed, hopefully will be within the month of October, my first one, at this point, I am doing a lot of consultations one-on-one, and I also do webinars. And so I can do virtual conferences and a webinar. And so if I have a handful of people, for example, that want to learn about the difference between aromatase inhibitors and selective estrogen receptor modulators, and they want to know what a CDK4/6 inhibitor is, and all the breast cancer stuff, right? All I need is 5 people. I'll do a lecture, no problem. I love that. I mean, it's actually one of the things that I love most about being a physician is the education component, really teaching people so that they understand. And, once you understand more about the medicine and about more of your treatment options, what have you, you're a better participant in your care. You can make better decisions. You actually second guess your doctor less because you actually understand why they're saying the things that they're doing. And it actually helps suspicion as well. I have another little anecdote on that. So I used to, because I was at MSK, it was such a big, tertiary center, we would see lots and lots of second opinions from outside hospitals, private practitioners. And it was not uncommon for a patient to come to me for the second opinion, like outraged at their physician. Like, I'm not going back there. I want to be treated by you and blah, 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 because my doctor won't order me a PET scan. And everybody says I need a PET scan because it's the best test that there is. Well, okay, yes. So let's explain and understand what's the difference between a CAT scan and a PET scan and an MRI. And if you understand the fact that, and this is not exactly how I explained it, obviously, but in retrospect, if you understand that a patient that just had ovarian cancer surgery, for example, and had a bunch of the things in her body removed and, tumors picked off of her colon and lots of irritation and inflammation in that whole area. Same thing with the breast, right? So a patient had a mastectomy and maybe a lymph node dissection. There's all inflammation up there. If you get a PET scan within 4 weeks of those surgeries, you're just going to see inflammation. You're not going to actually be able to see anything very useful. And so in that particular circumstance for this patient, it was probably better, because there was a question of what was left in the pelvis, to get an MRI, because that actually gives you better geographical definition, or a CAT scan, for example. And so once that patient understood that, she was like, oh. And, the thing that bothers me the most about it is not that she was upset and that I had to explain it to her, but it was a missed opportunity for her doctor. He just prescribed the CAT scan and he didn't explain why.
Right.
Maybe she didn't ask why, but if you've been in practice long enough, I already know if I say a CAT scan and the patient kind of squirms a little, I'll immediately tell them why it's not a PET scan instead, because I know that that's in the back of their mind, because they're going to go home and their neighbor's going to be like, but my brother had a PET scan.
Right, right.
And that's how it works, right? And so you have to also kind of anticipate what the patient is worried about. Same little scenario when you go into an exam room and a patient's like really mad about something, really mad. And, it takes a while to become enough of an experienced physician to realize that they're not really mad at you. They're mad at everything. They're mad at the lack of control. They're mad at, and so sometimes if you can kind of just name the emotion and sort of address that head on, everything kind of melts away, and then you can have a really much more productive conversation,
Right.
for example. So,
Right.
and it's a little bit off of a tangent, but I'm just saying that there's so many things and ways that patients are misunderstood. If that doctor had explained to her why she was getting a CAT scan instead of a PET scan, she wouldn't have to go run around and look for a second opinion. I mean,
Sure.
look, she's more than welcome to do so, but she would have saved herself the anxiety and stress and anger
Right.
of feeling like she wasn't being properly cared for.
Right.
It
makes me think about, there's so much information available online. And there's, on one hand, we want to advocate for ourselves. We want patients to be advocates, and their loved ones to be advocates for them. What is the advice? What is the balance of, you get the diagnosis, or heaven forbid, you see your chart before the doctor calls you, right? With all the electronic health records
Always.
available, happens all the time. And I'm the first one on there, and I see it, and then I go research everything. What is the advice to the woman listening that either has had a recent diagnosis and out there storming the internet and becoming, AI doc, or future knowledge? Like, if this happens to you, consider what?
So, the first thing that you don't do is go on TikTok, right? Or Instagram. Because although I'm on Instagram, and there are plenty of reputable doctors that are on Instagram, for the most part, that's not where you're going to get your best information. And most of us are on there because we're trying to counteract some of the counterfeit information that people are getting on the internet. It's always best to look at internet or national sites like the American Cancer Society, national NCCN, which are the National Cancer Guidelines, for example. You can even ask the nurse or the team that you're working with, where would you send me to read about this so that I can get some more background information? Because, Memorial Sloan Kettering, for example, has a wealth of information on their website. You just need to know where to get it and that it's there. There are reputable medical sites that are geared towards patients. And I can actually, before, when we're done, I could give you a list of some things if you wanted to put some links in the show notes afterwards for people if they wanted to find something else to look at. But I just, I really feel like you have to be careful about the information that you're getting, because, just because somebody says that if you drink, put castor oil in your belly button that you're going to lose abdominal fat doesn't really mean it's going to happen. And
What? Darn
And I
it.
tried it and it didn't work.
I know, for heaven's sake.
Well, but that's a silly example. But can you
Yeah.
imagine now, gambling with somebody is touting, a certain type of snake oil is going to make your breast cancer go away and it's less toxic and is less, harmful to your body than chemotherapy and the hormone therapies that your doctor wants. And people are doing that. And that's really disturbing. That's really disturbing because I have to tell you, so many people that are claiming to be doctors are not MDs or DOs. They are patients or people that may have gotten, a certificate in something or another. And so, you have to really be careful and really look at the background of the people that you're listening to and cross-reference everything with your doctor. Ask your doctor. Every doctor has a portal these days. I mean, we must have answered 1,000 portal messages a day. We used to call them, what are they? Portal cowboys. They were people that were on the portal all day long. I feel like I talked to them more by typing than ever in person.
Oh my gosh.
Because what would happen is they'd get home and remember all the questions that they forgot to ask. So that's the other thing. Make sure you keep a notebook somewhere or in your phone and just keep a running list of your questions. And if necessary, send them in the portal ahead of time, ahead of your appointment to your doctor so that they're ready and willing and able to answer them on the fly in your 15-minute appointment or what have you. So that's always very helpful as well.
Yeah. So good nuggets there. Write down your questions, put them where you have them in
100%.
advance. Utilize the portal, collect the questions, get them to your physician in advance of the appointment so they can anticipate. If you're going to do your online research, which everyone does these days, make sure it's a reputable source. TikTok and Instagram not being among them, and then cross-reference that data with your physician. I think those are really important, and I think loved ones can do the same thing, right? That
absolutely.
they have
100%.
a host of questions as well, and rather than peppering the person going through the diagnoses with all their questions, maybe they could write down the questions that they have and say, here are some of the things I've been wondering about. If you'd like to include them with your own list, because sometimes they're thinking about things from a different perspective. Yeah.
Absolutely. And, for example, oftentimes some of the loved ones will be the ones that are doing a lot of the research online, for example. And so I knew that people were doing this. And, when I would find a particular family member who was obviously doing a lot of research, I would just recommend to her going forward, if you want me to review this article before I talk to you next time, before I see you next time, just send it to me. And then I can't tell you that I'm going to do, a complete deep analysis on it, but I'll read it at least and be familiar with what you want to talk about. As opposed to somebody showing up in this 15-minute visit with, 3 articles that they want my opinion on. I'm like,
Exactly.
I'll read them at lunch. I can't read them right now, but yeah. So it's always better to try and give your doctor as much lead time so that they're prepared to help you, so that they structure the visit properly, so that they have time to do and explain the things that you need.
Yeah. So with climbing the corporate ladder without breaking a heel, our audience are, busy, ambitious women and those that love and support them. And so I want to spend a little bit of time just on anything related to prevention, to thinking about these are busy, the woman listening is busy, may or may not be raising children, but what we know about women is we are raising someone and pouring into others, right? Whether they're our own or someone else's, our communities, our churches, etc. Not putting ourselves first, which we, hearkening back to the beginning of our show today. Talk about some of the ways women can put themselves first in advance of any kind of diagnosis. What are some of the things that they need to be thinking about? And, just how do they better take care of themselves in spite of the fact that they have these crazy busy lives?
Sure. Well, I'm not sure exactly the age range that you're talking about. I don't know if most of these women are menopausal or perimenopausal, but let's assume that they are. Let's assume that they're 45 to 65 years old. Is that fair?
Yeah, I mean, we run the gamut, right? We're about 30 to 60 and growing because women are working a really long time. But start with that segment because I think that that's an important and we don't focus nearly enough on these perimenopausal, menopausal women. So let's start there. What are some of the things they should be thinking about?
So just off the cuff, a woman should be getting a mammogram every year, right? you need to know your family history. You need to know, what was on your mother's side, what was on your father's side. We want to know what your sisters, brothers, and your children, your parents, right? Know your family history. And I also usually recommend, especially for busy women, because once you do it once on a Saturday, it's there. Make yourself a binder, or make yourself a folder in your Google Drive. Sometimes I think it's easier just to print it and put it into a binder, but because you can flip it and bring it with you, where have you, and keep a list of your medicines, keep a list of your allergies, your family history, and your own medical problems, right? You want to know, and have perhaps also a list of the other doctors that you see. So it's all organized in one place in a binder. And so that could become, sort of your Bible of your own health, right? And then you need to obviously track the screening tests that you need to have. So women need to have a mammogram every year. Start at age 40, some start at 45, depends on which body of evidence you want to follow. I like 40. And if you have very dense breasts, then you might need an ultrasound as well. MRIs of the breast are usually reserved for patients that have a known family history or have a known genetic abnormality. But if there's something that they can't tell what it is on the mammo and ultrasound, an MRI might be in the cards as well. Pap smears. So right now, that it changes all the time. I recommend a patient see her gynecologist every year, and they'll decide when and if a pap smear should be done. I think it needs to be done at least every 2 years. I believe if you have 3 consecutive normal ones, then you don't have to do it as often. I've seen women with, if you've had a history, for example, of HPV infection, you probably need to be screened longer, because those HPV infections can lay dormant for longer periods of time. So I've seen women develop cervical cancer in their 60s and may or may not have contracted that HPV when they were, 22 years old. Okay. So that's very important. I always see a gynecologist. You should be having a bone density performed every 2 years, and because that's usually how often the medical insurance will pay for it, especially once you hit menopause, to see, how much bone loss there has been, what things we could use to mitigate that if necessary. And then colonoscopies, of course, are usually every 5 to 10 years, depending on your family history and what they found on the last colonoscopy. Right. So those are the major standard things. The other things that are good and important, obviously, is to get a full skin exam, probably once a year as well. A lot of people don't do that. And it's probably best, especially if you have any skin cancer in your family, and or if you were a sun exposed or a sun worshiper like me, you probably need to have some of those little spots checked occasionally. Let's see, what else can I tell you? So, and then there's the whole topic of menopause and perimenopause itself. And really important for women to be seen and heard regarding what their menopause symptoms are. And I'm sure most of your listeners have heard about all the big debates about the old WHO and WHI studies looking at, the role of hormone replacement therapy and whether or not it increases the risk of breast cancer. Those are basically being put away at this point. And for the most part, we're finding that we believe estrogen alone may actually be protective to breast cancer. And it's the combination of estrogen plus a progestin is potentially puts you at risk. That being said, there are so many caveats to that, right? Because I'm dealing with breast and ovarian and endometrial cancer patients. And so, patients that have a hormone responsive cancer, that requires a very lengthy conversation about risks, benefits, and all of that. We do know that estrogen is extremely protective for so many things in our body, in our life, such as our mental function, the brain fog, risk of dementia and Alzheimer's disease, cardiovascular health. It's important for skin maintenance. It's important for the integrity of your pelvic organs even. Wow. As well as your bone density, for example. And so and there's more and there's more and there's more. So every decision for a woman whether or not she's going to go on hormone replacement therapy needs to be very carefully balanced with risks, benefits, right? And it needs to be done with somebody who really has a good command of the literature and of the most up-to-date hormones to utilize. So for the most part, we're not using oral estrogens anymore because they're mostly equine estrogens, right? And it's really being favored to use topical estrogens like in the patch. There's an estradiol. It doesn't pass through the liver, and so it has less side effects and less risk for other issues. We're also shying away now from medroxyprogesterone and other synthetic progesterones. And so most women these days are being prescribed micronized progesterone, which is actually the true form of the same hormone that we make in our bodies. And so, and all of those studies that were done at the turn of the century in the early 2000s were not done with micronized progesterone. They were done with progestins. And so there's still a big question as to whether or not these our real progesterone is actually harmful or not, right? There's a question of testosterone. Do we need testosterone supplementation? But all of these things need to be very well laid out and discussed with your physician. And, you need to know your history. You need to know your priorities. And you need to really weigh the risks and benefits. The one caveat to that is that pretty much across the board, even medical oncologists are willing and able to prescribe vaginal estrogen. So nobody needs to have a dry, painful vagina anymore. We're all for pro-sex, less pain, less dysuria, you get less urinary tract infections. And so we've shown in multiple studies that the amount of vaginal estrogen that's absorbed from estrogen creams and inserts, for example, is so minimal that it has not affected the risk of breast cancer recurrence or initial occurrence. So
even in somebody that
have at it with the vaginal estrogen.
Well, there you go. Big fan of the vaginal estrogen. Even with somebody that had an estrogen producing breast cancer.
It's still being allowed, and I can certainly provide you with some papers, and you can put those in the links if anybody's interested in that as well. But
absolutely.
I was part of a study on VagiFem that was done at MSK on breast cancer patients, and that's a little tablet that you insert with a little plunger, and there was no increased risk of the breast cancer. So.
That's amazing. So listen, gals, you're going to get all of this on this show. even pro sex and healthy vaginas. So that's fantastic.
Did you know that August is Say the Word Vagina Month? Somebody just texted me that. So.
Oh, well, there you go.
Well. Next year in
depending
August.
on when this, that's right, hashtag say the word vagina August. Okay, good. Noted. One of the things, just to kind of wrap that segment up though, there's so much rich information, but it screams have a primary care physician so that you have somebody that knows your health history, and that sort of thing can be so, I think, completely helpful. I really love this idea. And I want to highlight this idea of whether it's through an app, like a health app, whether it's through you literally have a binder, whether it's a file on your computer, but this notion of your family history, when you've had your various scans, having how you're feeling, your medications, just all of that in one space, because most of us are so crazy busy that we're rushing in and we're rushing out, and we don't have all of that in one collective space. And then just to take the time even to just put that together can be a very empowering, put agency around your health and your health care. It simplifies the process. And then as things start to change, you have this living history of how you're feeling. So that
and
is
it's
so
easy
critical.
to add to it.
Yeah.
Once you have it set, you can just add to it as it goes, and it's not that hard to keep up. And if any of your listeners are interested, I'd be happy to do a little webinar on how to do that. I'd walk you through it. So.
That is amazing. So we're going to drop all kinds of links in the show notes. We'll get the links for the referrals and the places to get more resources. We'll cover everything from cancer diagnosis and some steps and tools if you're doing research there, to some of this perimenopausal, menopausal, and then just some regular preventative health. So I love that. We're covering the gamut. For the woman listening who's saying tick tick tick, those all apply. I want to close out. This has been not only fascinating but so educational, and again, I don't know that anyone in this day and age doesn't know someone who has, if not themselves, someone in their inner circle that has struggled through breast cancer, gynecological cancer, or something. So these are such great resources to have handy. I like to end every podcast with a stop, start, continue. So what should the woman listening start doing, stop doing, and continue doing?
Okay. Start doing. They should start putting themselves first and making sure that they are taking good care of themselves and that they are treating themselves the way that they would want, that the way that they would treat somebody else. Because we're often not nearly as kind to ourselves as we are to others.
That's right.
What I want you to stop doing is I don't know. What should they stop doing? They should stop doing.
They should stop thinking they have to do everything.
That's a good idea.
Right?
Stop thinking they have to do everything.
Back to your list. I love your list and the comparison, right? Yeah.
Yeah. And continue doing, they should continue being the badasses that they are.
Love that.
Women are going to make and move and change the world one person at a time.
Yeah. Absolutely. Oh my gosh, that is a powerful close. And Dr. Troso is helping us get there by keeping us healthy, helping us through diagnoses, helping loved ones who are shepherding and helping to navigate somebody through their health journey. And we're so thrilled. Thank you for all of your experience, your wisdom, and just the work that you're doing to give back in a unique and new way and make yourself available outside the geographic boundaries. That is so important and so critical. We're very blessed to have you in this space. Thank you so much.
I was honored to be asked to be on your podcast, and this was such a lovely conversation. I really enjoyed it, and I really am very, very impressed with what you're doing as well, especially from the very rich background that you've come from. You're really helping so many women.
Thank you so much. Well, that concludes today's episode, you guys. This is your coach, Dr. Cynthia. Thank you so much for tuning in. Remember that October is all about women's health. We're going to have a number of wonderful, special, wise guests on this month. This is your opportunity to lean in, take care of you, and put yourself first. Until next time, you've got this.
That concludes today's episode of Climbing the Corporate Ladder Without Breaking a Heel with me, your coach and host, Dr. Cynthia. Congratulations on choosing to invest in yourself. I know your time is precious, so thank you for spending a little bit of it with me. I believe in helping you step forward, look up, and realize your full potential. So if today's episode resonated with you, I'd be so grateful if you rate and comment on Apple, Spotify, or wherever you tuned in. And if you know someone who would benefit, please share this episode with them. Before you go, fuel your next step. Grab a copy of Now You're Next or pre-order a copy of Human Capital Investment Strategy, both available online at Amazon. Let's stay connected. Visit me at cynthiabentzen-mercer.com or find me on all the socials and follow me at Dr. Cynthia Bentzen-Mercer. Until next time, remember, boldly start working on your future today.